Preeti, if you can say hello. Preeti?
Hi.
Hello, Dr. Preeti.
Hi.
So she is also from our institute.
Okay.
We
And
have
pediatric nephrologist?
no, she is neonatology
Neonatology.
primarily,
Okay.
Yes, sir.
and we have has our deputy director joined. She should be joining Surupadi. She's from biochemistry and our deputy director of ICH. And we also have our main, like the person who is actually running this show, Dr. Sayantoni. Has she joined?
Hello, good morning.
Yeah, she is a statistician
Good morning.
from Praxis Business School, and ICH has recently done a MOU with her for like helping our PGT's thesis as well as the research projects that we are running. So she would be helping us. So these are our three main like who's running this thing. Idea is like it is as you know, I discussed this with you that we originally wanted to do the writing workshop
Yeah.
that
No,
IP runs.
first you should do the research methodology workshop. And
Yeah.
after that, maybe after 3 months or 6 months, whenever you get a chance, then you do the art and science of
Yeah.
writing.
So with so these are the two workshop which like IIP has Indian Academy of Pediatrics. They have sort of formulated a full module, and they run it regularly. Has it been running in West Bengal before?
I am not sure. For last,
Not in
I
the
have
last
been
few years.
no, I have been associated with. This is not of IAP actually. This is of Indian Pediatrics. So Indian Pediatrics, I am associated for last 8 years. So I don't think in last 8 years we have done in West Bengal.
So we were
There might be
hoping.
there might be a capsule course which might have been done somewhere,
I
but
don't
not the
think
full
because
one.
like since I am here for the last 8-9 years, I haven't heard about this.
Okay.
So
No,
we
it's
were
a good.
hoping that that we
It's
will
a
be able to run it, but then the
oh yeah,
pandemic came.
yeah.
So this is sort of testing the water and seeing
Yeah.
how responsive it is.
I
Yeah.
think it's high time our students got to learn something of research and statistics, because even I remember during post-graduation days, we did not even know what PICO was.
Yeah.
Yeah. Everyone, it is a pleasure to have all of you here on Sunday morning. So this is the second day of, as you might have been hearing, a sort of an experimental endeavor where we are
दरवाजे बंद कर दो.
trying to introduce this concept of research and analysis, etc., into our postgraduate trainees as well as into ourselves also. So this particular course is being done through Institute of Child Health along with Praxis Business School. We had quite a good session yesterday, a fantastic lecture from Professor Piyush Gupta, who ended up talking without slides, but I personally, and I'm repeating myself, I thought it was much better than with slide also. So it was a fantastic intro to what should be research around. And then we had Dr. Sayantani sort of introducing us to what sort of statistical questions we need to do when we are thinking of doing research work, be it as a thesis or as a hardcore research. Today we move forward to our second day, and our first topic will be a very important topic of framing a good research question. And I am sure Dr. Abhijit and everyone else will agree to this, that a success of your research, be it thesis, be it hardcore research, anything, depends upon whether you have framed a good question or not. And that, at least to me, always is the Achilles heel. And that looks really bad, that you have done half of the research and then you go back and understand that your question was not right. So that is inappropriate, and hopefully he will be covering that. And then again, Dr. Santhony will lead us through the nitty-gritties of statistics. Hopefully she will be today concentrating more on just data, which another important thing. So whenever we talk of statistics, we straight away going to what is the p-value, what is the regression analysis, etc. But again, what is most important is the data, and how you collect the data, how do you interpret the data, how do you classify the data. I think it is like as important is framing a good research question for your thesis or your research work. Understanding your data is the most important for statistics. So these are the two things that we will be covering today. So at the start, I would like to welcome Professor Abhijit Saha. He is what we can say a Provasi Bangali. He is a Provasi Bangali, but now settled abroad in Delhi. He is a professor of pediatrics in Division of Pediatric Nephrology, Lady Hardinge Medical College and Kalavati Saran Children's Hospital, New Delhi. He is the not known representative of Indian Society of Pediatric Nephrology. But to me, what is very important is that he has been attached, involved, and is an editorial board member of Indian Pediatrics. So that sort of gives him oodles of experience in analyzing various papers and guiding us. So Abhijit, it is all over to you. Thank
Thank you,
you.
Rajiv, for a nice introduction. And at the outset, I thank Dr. Rajiv for inviting me for this talk. And what I have done is I have kept it very simple, keeping in mind the MD thesis, which we do with our students. And this is according to the Delhi University guidelines. We submit the study protocol, and every year we do a 1.5 day uh, protocol writing workshop for our PG students. And we keep it really simple according to the requirement of the postgraduates, what they should know before they start doing their MD thesis. So framing a good research question. So the key components of a research project, any research project, to be more specific, an MD thesis project, is identifying these 5 things, 6 things in your research project. You must identify what is the lacuna in the existing research, what you want to do. Based on the literature search, you identify the research gaps, and then you try to frame a research question, which I will dwell upon today. From the research question originates the research hypothesis, which you would be testing. And this research hypothesis is subject to statistical analysis and verification. You translate your hypothesis into aim and objective. I am not going to go into the details of aims and objective. I think somebody else will speak. So just broadly, aim is a broader term which you describe for your thesis. An objective is a specific uh, uh, more specific thing which you actually do uh, in your thesis, which is again can be divided into primary objective and secondary objective. And the dictum is that the primary objective will determine your sample size. So it is always good for an MD thesis that you keep only one primary objective, and you can have two or three more secondary objectives. But remember, the sample size is always calculated by the primary objective. For big research projects, you can have more than one primary objectives. But remember that if you have more than one primary objective, then you have to calculate the sample size differently for both the objectives, and the larger sample size, the largest among the two or three objectives which you have taken, would be the final sample size. So for MD thesis, we do not advise to take more than one primary objective, and uh, the related things you can put in the secondary objective, which will give you some meaningful information also. And for that, your sample size would not warrant calculation. You can always back calculate after completion of the study whether the results you have got in the secondary objective are valid or not. Then after aims and objective is the detailed methodology, how you would be doing your study. And that also includes the inclusion criteria, the exclusion criteria, sample size calculation, and detailed methodology. So this is the part of the methods which you write in your protocol. And lastly, the primary outcome and the secondary outcome, which which is again exactly linked to the objective of your study, the primary objective and the secondary objective. So this is basically the research framework which we work upon with our postgraduates. And this is all, uh, to this we add on to how to do a literature search, and this forms the 1.5 day workshop. So I will dwell upon today the how to develop a good research question. uh, it is not though it is very important, it is not very complex also, I would say, if you have some basic clarity of how to go about it. Now, developing a good research question, you should have, for whatever subject you have chosen, you should have a good background knowledge of that subject. You must have identified some research or what you say, uh, uh, lacuna in the existing research, what we call it, call it, and based on that, you can develop research ideas. I primarily work usually on more to the uh, basic science related research projects. So it can be anything. Research can be, it can be a clinical question. It can be a basic science question. But what you have to uh, do before you frame a research question is to think what you are going to achieve from that research question. So you should think what would your study add to the knowledge of the condition that is different from the studies which have been already conducted. Say, so it's a common saying कि research मतलब दोबारा से search करना in Delhi, no? So don't do a search research which has already been done. The topic can be the same, but what is different which has not yet been done or not yet been reported? How will my research benefit patients? See, we are all are here for our patients. So sometimes, there are some ambitious students or some ambitious, teachers who think that let us do a research which will get published in this journal and that journal, in that impact factor journal, but probably is not related to the basic, basic patient care. So you must always think how will your research benefit patients. will change the existing practice in diagnosis or treatment, or it can be even related to a basic science question. But how will that, what is the translational value of that basic research? So that thing, that element you should find out before you formulate a research question. Why it is important that the practice should change. So if something is evidence based and which is going on, and there is probably at this point of time there is no need to change that practice, probably doing that, formulating a research question around that is not a good idea. So that thing also you should keep in mind. Will you be comparing, contrasting, proving, disproving, identifying any novel finding which is of interest, or negating an existing finding uh, which is again linked to the patient care uh, in some or other way? So these are some of the questions you should first ask yourself, discuss with the student, ask him to read about it. And believe me, some of the students are excellent. They can think what we cannot think, because they are fresh minds. They have they can analyze things sometimes much better, in a much better way what we can do. So have faith in them, give them the topic, ask them to read, but keep these things in mind before you dwell upon a research question. So a research question should be well conceived, which provides framework for conducting and achievable. Now, suppose I am giving an MD thesis. I know that the range of patients I have is tremendous, but the sample size uh, I am calculating is coming out to be 100. So that's not achievable. So that research will not give me valid results, or the time frame of the research, the follow up of the question which I am asking requires, say, 6 months of follow up. So the MD thesis, total duration of MD thesis is 1 year. So if that research question requires a follow up of 6 months, so that means you are recruiting patients for, so the actual duration of your recruitment is only 6 months. Another 6 months you are going to get the follow-up data. So that's probably not achievable. So how much follow-up is required for that research question to give valid answers? Again, too broad a research question, um, um, you know, kinds of create difficulties in getting valid answers. So the question should not be too narrow, it should not be too broad as well. And I'll give you examples. And it should be clinically relevant. So again, formulating a research question requires a systematic explanation, exploration of different components. I think somebody needs to unmute. Yeah, thank you. So also remember that the research question will have will feed into the title of the project and give you this snapshot of this research summary. So many a times, uh, when you publish the research, uh, the citability is uh, the readers will read the topic, what actually it is telling. So actually the research question is a snapshot of the research summary which you are dealing, and will enable readers immediately whether the study is applicable to their research area or not. So that is why it is very important to dwell upon these things before you go into the specifics. Now, how do you select a topic? So broadly, you have to, it's an inverted pyramid. You can have a topic, for example, nephrotic syndrome, There are different components of nephrotic syndrome. For example, diagnostics, the treatment, follow-up, complications. So you narrow down, okay, from within the nephrotic syndrome, I will I will focus on the complications. So there are n number of complications. So for an MD thesis, maybe you can pick up one complication, and based upon from one complication, there might be a specific aspect which you would like to formulate a research question about. So again, you do a literature search and try to narrow down your uh, topic of research which you are going to do. And it usually follows a, if you try to think upon, it will follow usually an inverted pyramid, and then you can narrow down to your research question. So before that, why do we need a research question, and how to develop a research question? These are the only two questions which needs detailing. So research question frames your study. It narrows the scope of research. Again, because too broad a research question is difficult to handle. You will get so many results that you will not be able to handle. And it enables the researcher to ensure the research project and makes it manageable. Now, different types of research. You know that there are broadly two types of research. One is quantitative research, other is a qualitative research. I do not usually dwell upon qualitative research. I don't have much expertise on doing qualitative research, but in broadly you can say non-numerical research is a qualitative research. It's a totally different kind. Analysis is different and all. So I will dwell upon more on the quantitative research with which 99% of the MD theses will deal. So your research question can be descriptive questions, which usually seeks to describe a concept or topic. For example, what are the characteristics and types of neuropathic bladder? It can be everything. So it's kind of a descriptive research which you do. It can be comparative. What is the association between, say, tumor rupture and recurrence of Wilms tumor? So it is kind of comparing two variables. It can be linked to the causality. For example, does adding one modality affecting the outcome uh, of a disease, particularly a particular disease, for example, whether adding a chemotherapy, uh, improves the outcome or differs the outcome in any surgical tumor, say Wilms tumor, as compared to chemotherapy alone. So these are different kind of research question, but ultimately the format is the same. And there are some differences uh, which I'll tell you. Qualitative research, research question can be exploratory, predictive type, interpretative type. I usually don't deal with qualitative research, so I'm not an expert, but just for theoretical knowledge, uh, quantitative research questions are of different types and qualitative research questions are of different types. So ask yourself, what are you trying to examine? What do you want to learn from this research? What is the purpose of research? These are the broad things uh, before developing a research question, and then you come to the research question proper. So now I am entering the research question. Now, the one of the mistakes which many of the postgraduates do is that uh, do not frame it as a question. So as we say that it is a research question, so it has there has to be one question mark. So a research question cannot be statement. It has to be question. So obviously it will contain what, who, when, why, does. So your research question will always end with a question mark because it's a question. So that is one dictum. Use language, discover, generate, explore, identify, describe. These are the various terminologies which you will use in framing your research question. and it is usually open-ended question. I hope you understand what open-ended question that is demanding some kind of a discussion while you are framing that research question. And ultimately, it is important to ask the right question, because as Dr. Rajiv very rightly said, asking a poor question will lead to a poor research, and then you will have probably will not get a valid result, and will since we always feel that a postgraduate will devote say 1 year, 1.5 year into research, that research should always be publishable, and a non-publishable research equates to research which has not been done. So, whatever is the research question has to be specific, and we'll come into uh, the details very soon. Before going into that, just a word about that. If you do not do a good literature search before framing a research question, you are likely to miss some of the points. So, an extensive literature search is a prerequisite to a good research question, because that will identify the existing gaps in the knowledge. And in the research protocol there is a specific section: what are the research gaps, what is the lacuna in the existing literature, and what is the justification of your study, why you are doing this study. uh, Also review whether a future research can be, because normally what we do when we do a research project, it usually the results would lead to some or other questions with which you can play around in the next in your next candidate. Or so you can do a series of research. One candidate starts it, the other, for example, we do we can do simple thing, we can do complex thing. We plan a research on say identifying some biomarkers in nephrotic syndrome. So somebody can look at one student can look at the discovery phase of proteomics. You get some results, you get a lot of biomarkers, the other student can validate one or two biomarkers by ELISA. So see whether a series of topics can be so that way what will happen, as a researcher you can get hold of one area of research on which you can sort of uh, have little expertise. Now, if I have done, for example, endothelial dysfunction, if I have done, say, 10, 15 biomarkers on identifying endothelial dysfunctions, so I sort of gain little bit of, expertise in that area, maybe cardiovascular morbidity, mortality in patients with nephrotic syndrome. So see, also try to explore while giving a research project whether future research can also be done on those topics, or whether results of that particular topic will generate some more research questions which you can work around, and the clinical utility. Now, this is all which you were talking, Dr. Rajiv, that one should always teach our students to formulate a good research question around this format. So what is the population who in whom you are going to study, do this study? So that needs to be defined in your research question. What is the intervention in case of a randomized controlled trial? In case of a observational study, what is the exposure? Is there any comparator or control to whom you will be comparing? What is the outcome? You need to define the outcome. And is there any time frame that will be depending upon the type of the study. So this is what is called the PCOT format, the uh, PICO format, and in some studies you will have the PCOT format. So the population intervention comparison outcome and the time frame. Let us look at the example. So does hand washing alone among healthcare workers reduce hospital acquired infection as compared to hand wiping? So what is the population here? The population here is healthcare workers. What is the intervention? Hand washing is the intervention. What can be the comparison here, comparator here? No hand washing or any other hand washing, hand wiping. What is the outcome? You are looking at hospital acquired infection. So this is the PICO format. You can add a time frame. Now, is it a good research question? Now, in this format, in this online format, there is the interaction scope of interaction is little less, but uh, is it a good research question? So we usually ask, so if you look at population intervention comparison outcome, yes, it is, the elements are there, but this is not a good research question. This is actually a bad research question, because everybody knows has been enough evidence that hand washing is the best method to one of the best methods to decrease hospital acquired infection. So though it fulfills the population intervention comparison outcome, this is actually in whole, this is a poor research question, because what will you achieve which is already uh, proven with which very good certainty that just wiping hand will not lead to decrease in, it's already established. So this is not a good research question, though this fulfills all the PICO format. Similarly, say does application of say drug CNC ABC in children 1 to 10 years improves outcome? You have to define symptomatic radiological in patients with corrosive esophageal strictures over, so they have added a time frame over next 5 years. So population you can define here. Intervention is application of mitomycin C. Comparison is no application of mitomycin C. What is the outcome? Outcome is symptomatic outcome. Again, you have to note down in your methods what specific symptoms you are looking for. Radiological relief is the again an outcome, and time frame they have added is in next 5 years. So this is how you frame a question. So what are the effects of video gaming on attention span? Uh, on attention span of adolescents uh, between for 10 to 5 years. So population here is adolescent, intervention is effect of video gaming. Comparison, those who do not play video games, and the attention span is the outcome. So this is all about this. So you can have n number of questions, different types of study here. Do first year medical students who complete a student run anatomy review course score higher on our anatomy final exam than students who do not complete the review course? So a research question would be, do first year pediatrics medical students who complete the protocol writing workshop run by Dr. Rajiv Sinha do a better, can complete a better, uh, develop a better research protocol tested on this scale than students who do not complete the review course done by ICH, whatever. So these, if you understand the things, then it is very easy to formulate research question. Only thing is that
Hello, have you lost him?
So his voice is not coming.
We have lost him. Okay,
I think network issue or something.
I'll give him a call.
was telling you, yeah. So whatever you can, as I told you, a good research question can be, does the research protocol which is done by ICH leads to You can have a scale on your outcome of the research protocol, and then you can test it. So that can be a research question. So there can be n number of examples, but just to enumerate, see, I have rephrased some of the questions, and I think you would agree that the rephrased ones are slightly better. So what is the childhood obesity rate in India? So it's not, it's too broad. India ka obesity rate study karna is too broad, no? So in our setting, we can test how does education level of parents impact childhood obesity rates in India. So that can be a multi-centric study. Different centers can get involved, and probably this will be a good research question in terms of both following the PCOT format and also containing what kind of information you get out of research, and whether it is publishable or is of interest to the audience or not. How much time do young children spend doing physical activity per day? Two objective. So in other words, it could be better phrased as what is the relationship between physical activity, open-ended, physical activity levels and childhood obesity. What is the effect of childhood obesity? What are the effects of childhood obesity in India? Okay. So how does childhood obesity correlate with academic performance in the elementary school? So these are some of the examples where how you can play with your research question, and can decide about which one is doable in your setting and which you want to do. Now, one of the very important aspects of which we deal with, we every year we listen, say around 27 research topics in our department. Now, some of the I would say students or some of their guides are very ambitious. They think, let us do this, let us do that, and we will publish in 6.7 impact factor, and they will plan a lot of very ambitious projects. Say for an MD student, a sample size of 150. So is it feasible enrolling 150 students, or very intensive, say, a questionnaire based research topic, especially, say neurodevelopmental outcome, and also where the questionnaire has got 100 question. So imagine if a student has to ask 100 questions for one candidate. Enrollment of one candidate requires 100 questions to ask and to note down. So for every enrolling one patient, he will have to spend, even if he spends say 30 seconds on each question. So you have to analyze these things when you are planning your research. So for every question, if he is giving for question, explaining the question and noting down the answer, if he's uh, giving 30 seconds, so that means 50 minutes for just dealing with that questionnaire for enrolling one patient. And if he has to enroll say 150 patients for his thesis, and then do the from the pro forma, he has to transfer that information into the Excel sheet, then analyze, and then get the results and then write. So is it feasible? So probably that feasibility is not there. Or if I do a thesis of validating a biomarker, which requires validation always requires a larger sample size. So the sample size collecting is 200, but the test, the ELISA, is not done in my institute. It is done in some other institute, which is 20 kilometers away. And the sample needs to be transferred in minus 20 degree. Or say I do a discovery phase of proteomics, for which the sample needs to be stored in minus 80 degree, and then it needs to be transferred into dry ice to a center on same day. So, and that institute is 15-20 kilometers away from my institute, because the collaborator will be doing proteomics there. So the feasibility aspect of doing a study is very important. Then, for example, you plan a thesis on say ELISA. Now that particular kit is costing 40,000 rupees. So where from that funding is come? So in a nutshell, in different aspects, that study should be feasible. If I plan a study for which a sample size of 40 is required, say steroid resistant nephrotic syndrome, I should be sure that 40 nephrotic syndrome, steroid resistant nephrotic syndrome, will come to the OPD in next 3 months, so that he can enroll my student can enroll those 40 students, and then he can translate that the data and fill up and do the study. So that is the feasibility aspect. So we formulate a mnemonic called FINER. So a good research question should have a component of PICOT, PICOT, and should have a characteristic of finer maps. So finer is definitely maps people have added. So I'm enumerating that also. So this is the feasibility aspect. The other aspect, it should be interesting. So interesting to the investigator, interesting to the audience, uh, which is there. For example, currently COVID is going on. So if I look at the complications of, say, if I look at the MISC, what proportion of patients of multicystic inflammatory disease were admitted in my COVID-19 in my hospital. So that's very interesting, because uh, uh, it's a new entity. There was a lot of mortality, and it was not studied before. So it's interesting to the not only to the investigator but also to the audience. It should be novel, as I told. MISC in COVID, it's a novel. So it confirms whether, so patients might have COVID-19 patients might have presented with fever, difficulty in breathing, but did they had MISC? It's a novel finding. So that confirms, so it can confirm, it can refute. Don't go by fixed ideas कि मेरे को तो पहले से सोच लिया कि अच्छा 100 पेशेंट्स आएंगे कोविड के, उसमें से इतने इतने को हमको MISC बना ही देना है, चाहे उसको हो ना हो. So you do study 100 patients of COVID, have an inclusion criteria, and then you report that, okay, in UK, this many percentage of MISC was reported. It was not seen in India. We had only 1%, or we had this much percentage. So you can confirm, you can refute, but don't go with a fixed idea. So always keep an open-ended question, and whatever the results are there, you report. That is only true research. Some people think कि अच्छा वो result भी पहले से ही सोच लेते हैं कि इसमें ये मिलेगा, इसमें ये मिलेगा. You must have idea, but at times more so with the basic research, when you do, you might be testing 3 or 4 biomarkers, but all of them might not come very, might not give significant result. I will give you an example. We tested 4 biomarkers for endothelial dysfunction in nephrotic syndrome. So 3 of them were elevated, the levels were elevated, 1 were not elevated in first episode nephrotic syndrome. So we reported that this particular biomarker was not elevated. Then it should be ethical. So all research projects should go through the ethical committee, and in our MD theses also, all the MD theses go to the ethical committee and has got a ethical clearance. So in one, the 4 experts were in the institute presentation. There are 2 members from ethical committee also, so that 2 presentations are not required. So simultaneously ethical aspects are also seen in that project. So you cannot do, so that is why in MD theses usually we refrain from doing, you know, what you can say, newer drugs which has not been yet tested. So those kind of topics we usually do not plan, so that the ethical the ethical committee is comfortable with the research topic, and it should be relevant. The other things, the manageable, obviously don't plan a research which will give you so much of data that you are not able to handle that data. It should be appropriate to the clinical setting. It should be of potential value, that is uh, to the researcher. It should be publishable. It should be systematic. So you should remember that the final criteria is applied to a good research question, and take all these things into consideration. Think before you finalize your research question. So why it is important to think before starting? Because it gives clarity to the problem. It facilitates the subsequent steps of research process. It helps select appropriate literature of review. It anticipates what problems, what hurdles you can face in that research, and you can also plan the resources needed. For example, you can do a biomarker with chemiluminescence, you can do a biomarker with ELISA. Now, if you have not dealt with in the PCODE format, you don't know what methods you are applying, you will apply, then it's a problem, no? So it improves the, also if you beforehand, if you finalize everything, it also improves the efficiency of the research. Be always critic to your own research question. Once you formulate the research question, discuss with your peer, I mean your colleagues. Two or three of your co-investigators can always point out what is the problem, whether it is clearly stated. Ask questions from yourself, whether you have stated in the question format, whether it is testable. Define variables to be studied, define sample to be studied, describe the setting of the study. Now, once you have formulated the research question, I am just going beyond, one step beyond, and that is linking the research question to the hypothesis. Because all this, the lacuna in existing research, research question, research hypothesis, aims, objective, methods, and outcome, they are all interlinked. So you have to see everything falls in line. So if there is any deviation, then uh, things are not appropriate. So you have to always link your research question to research hypothesis. So what is research hypothesis? The assumption that you are interested to prove within your research study. In another words, it is the transformation of the research question into the operative analog is what is called as a research hypothesis. And remember, the other important thing, hypothesis is subjected to the test of significance. That means is subjected to the actual statistical analysis which you are going to do. So let us take one example and then I'll stop. So suppose, being a nephrologist, uh, suppose I find out that a lot of people have done a lot of studies on hypertension in steroid resistant nephrotic syndrome, but people have not looked at what proportion of patients have hypertension, what proportion of infrequently relapsing nephrotic syndrome have hypertension before starting steroids, and what happens after they achieve remission. So I do a literature search on PubMed. I'm not going into the details how to put on the keywords on PubMed and try to narrow down your research, but I find out and I see that infrequently relapsing nephrotic syndrome have there are not many studies as to what proportion of them have hypertension. Another important thing which comes in my mind is that there is a new definition of hypertension which has been given. The cutoffs are new. So whatever data on hypertension is there, it is based on the older definition of hypertension, whereas newer charts are there. So again, my data is going to be novel. So I identify this lacuna in existing knowledge and I justify my uh, research question in front of the board, and I plan a research question, a simple research question. What proportion of children with infrequently relapsing nephrotic syndrome are hypertensive during relapse compared to remission? And I try to fit in what is the population here in frequently relapsing nephrotic syndrome, what is the exposure here. So intervention oblique exposure. So intervention is there when you are doing some interventional study, for example, uh, a randomized control trial, or it can be if you are doing an observational study, there will be some exposure. So what is the exposure here? That a patient is going to relapse. That means there is some alteration in the pathophysiology here, which is going on. So exposure here is the relapse state. What is the comparator? You are going to compare whether the patient is also, what changes are there in the blood pressure during the remission state, and what is the outcome variable here? Outcome is hypertension. So this is a research question. Now, what is the hypothesis here? You have to quantify the hypothesis. So you assume with the literature, you do a literature search, you have some background knowledge, and you look at the literature, and then you put in the percentage here that at least 25% of the hypertensive, the infrequently relapsing nephrotic syndrome would be hypertensive during the relapse state. So you have translated your research question into hypothesis. So this is your hypothesis that at least 25% of them would be hypertensive, and base this 25% will also, you have to link it to your methods in your sample size calculation, that okay, you will take the effect size of 25%. What would be the aim? So aim is always a broader term which you use, and the objective is actually you have to write down what you are doing. So now many of the experts would have objection in this term prevalence. They will say that prevalence you can use only in community based research, but we have, as clinicians, we it's a matter of debate. We take a plea that for our, not every researcher can go into do a community research on prevalence. So being prevalence in large hospitals, since we have very large patient load, say we see around 8,000 nephrotic syndrome patients a year. So we can study prevalence in hospital setting as well. But I know that some of the more so those researchers who are from PSM department, they can have an objection that you please don't write prevalence, write proportion. But we do write prevalence and it is accepted. What would be the objective? So objective, I'm just going, I will not dwell in details the objective, just to show you how to link your research question to your objectives. So the objective should be SMART: specific, measurable, appropriate, relevant, and time related. So this is the mnemonic which you use. Now I have translated that research question into primary objective. The To identify proportion of hypertension among children with infrequently relapsing nephrotic syndrome aged 1 to 12 years during relapse before starting prednisolone. So I have made this very specific. Measurable hypertension you are going to measure, and this is achievable for me, it is relevant, and it is time related. So this is how I have translated my research question into a research hypothesis, and then I'm not going into the details of into the methods, how I calculated the sample size and all, but I just to give you a snapshot. Now, this primary objective would define my sample size, and there will be certain more secondary objectives which I can put into. But again, these secondary objectives should also be in line with the Picot format, and also should be with the finer criteria. So I have put on, say, I would proportion of hypertension during steroid induced remission. So I am longitudinally following these patients. So my primary research question is that I will look at the proportion of hypertension before starting steroids, and I am in the secondary objectives, I am putting it that once they achieve remission at 4 weeks, I will look at the proportion of patients who are hypertensive, and I will also correlate hypertension with dyslipidemia, hypertensive retinopathy, and left ventricular hypertrophy. But these are all my secondary objectives. I, I am at liberty not to calculate sample size for these at this point of time for my MD candidate. And then I'll put some inclusion criteria, exclusion criteria, and then I have to put the primary outcome measure. Again, you have to link your primary outcome measure and secondary outcome measures to your hypothesis and research question and primary objectives. So for this, your primary outcome measure would be proportion of children who were hypertensive among IRNS during relapse before starting steroids, and accordingly the secondary outcome measure. Just to complete the whole thing, so your entire research is linked to your literature search, to refine the questions, to define the operational variables, link it with the study design, obtain IRB approval, and then publish the research. That's all. Thank you so much. If there are any questions, I would be happy to answer.
Hi, sir. I think there's been one question is how to review literature, but
So I told you that's out of the scope of this particular talk, but reviewing literature is, I think it's a 2 hour, 1.5 hour presentation. So broadly, but still somebody has asked, so I will answer. So you can use different search engines to do the literature search. What we use is the PubMed, and we put keywords into PubMed, and you have certain Boolean words which are important, which you have to put on. These Boolean words are and, or, not. So if, for example, for this, the example which I gave, if I put on, if I open the PubMed, I go to advanced search and put on, first thing is nephrotic, infrequently relapsing nephrotic syndrome, put that in inverted commas. Then I put a Boolean called add, and I put in hypertension. So that will give me a list of articles which have where infrequently relapsing nephrotic syndrome have been studied, and where hypertension has been studied. So this is broadly, you can do the research. You can also directly feed in some of the keywords and do the research. You can put some mesh words. You can just go put the word nephrotic syndrome, go to mesh words, select some of the mesh words, and then do the search. Briefly, just to answer some whoever has asked the question.
Yeah, and like if you don't even know about what is this boost miss words and all that, then also you can use the PubMed.
Yes.
NCBI, and go to the PubMed, and then just type the what you want to look for. For example, in this particular scenario, we want to look for the hypertension, and nephrotic, infrequently relapsing nephrotic syndrome. You just type that, and initially it might come out to maybe it will be say 5,000 article. You don't have time for reading the 5,000 article, then you can go for the limits. That is more easy.
Five
Limits
years.
like you can then you can take that you want only in pediatric. That itself usually reduces the number of articles, because research in pediatric is anyway less than in adults. And then you can take that you don't want, suppose you are looking for only review articles, you can think I want only review articles, or you want only original articles. All those will limit your search.
Yes.
And many of these articles are also online free also. So you can also tick that
Only
you
free
want
article.
only those which are free article.
You can limit the search to say next 5 years
Time
or
also, yeah.
time. Only
You
5 years.
you
Only
you
one.
want to only last 5 years.
Only
So
RCTs. Only clinical trials. So that will
so
reduce. So there is no
So
limit.
we get very worried. At least I used to get very worried about all these Boolean terminologies and maze words, etc. But then you can use, like I have found it that you can use it even without understanding all that.
Yeah, but understanding these terms are also very easy. Once you
Hmm.
know these terms, you
Yeah,
see that they are nothing. Only thing is that
it becomes easy, and you can store your search also. And hopefully, if we get enough interest, then we can have a session on literature search
I think
in
it's
the
really
future.
interesting because for most people, searching literature is equal to Google search, but it is not equal to Google search because Google only shows certain
Huh.
non-scientific as
no,
well.
no, no, no. We don't advise Google search because
Huh.
Google search is all manipulative.
Google.
Yes, that is what I'm
Because yeah,
saying.
you can pay
Literature
money and ask Google to put uh, prioritize your research. So that happens. So please don't do Google search
yes,
for
that
for
is what
scientific
I'm trying to
literature. Yeah.
say.
There was one
Somebody
more
was asking
question.
about there
Yeah.
was one question on objective, I think primary or secondary objective.
No, before that, there's another question. That is something which always we also have problem. Like suppose if you're going to do a, unique study, then how do you calculate the pilot? Then how do you calculate the sample size?
So if the prevalence of disease in question is unknown, then a pilot study of population. So you say I am doing pilot study. That is the best way. That is what we do. So we don't say that we are
So,
doing a study.
sorry, even if it is a big study, then
Yeah.
also we mention that it is a pilot study
No,
because we don't
no,
know.
we don't usually don't do a big study in MD thesis. Be very clear. So if you are a very big researcher, you are doing a multicentric study, and if you have to generate. That is what if you talk to the pure statistician, they would say कि first you do a whatever
Pilot
first
study.
you are doing, that you do a pilot study. Then you say with this study we are calculating, or you back calculate and say that okay, whatever sample we had taken is appropriate for the study we have done. That is what is done. I think the Dr. Shayanthani, who is a statistician, would can answer better. But broadly, that is what we do.
And then there's this question in the, are the primary as well as secondary objective necessary to be mentioned?
No, usually, one focused primary objective is definitely required, but usually what happens, there is always a scope of looking at some other things which are also relevant, and which if you formulate a question beforehand, you would definitely look into it and generate data out of it, which will help you in publishing the result. So at one hand, it is not mandatory. Nobody is going to in your the DU for us, Delhi University is not going to say that you have not put secondary objective, so this is an inappropriate protocol. No, they will not. If you have put in primary objective, that is, they are okay with it. If you have not even put a secondary objective, but Look at the other side. If you if if you have some additional things which you can study in that project, for which you do not need to calculate sample size, but some relevant data is coming out of it, and if you don't define it beforehand, then some lacuna is going to be left in data collection. So you will not get the data, appropriate data, if you have not defined it beforehand. So it is always good to define it beforehand, generate that data. It will be helpful in publishing the research when you add on to it in your manuscript. That, for example, the question which I showed you, infrequently relapsing nephrotic syndrome. We studied 80 patients. 3 of them, we got hypertensive retinopathy, and I think uh, 3 of them also had left ventricular hypertrophy, and a proportion of them also had concentric, hypertrophy, what defined by the echocardiography. So, though we did not calculated the sample size for it, in the discussion we have say one paragraph to write about that. Even in infrequently relapsing nephrotic syndrome, we had a proposed, though less number of patients, we have end organ damage. Though we have not calculated sample size for it, but that is generating another research question to us, that whether a proportion of infrequently relapsing nephrotic syndrome have end organ damage, though the proportion might be less, but is it relevant to look at the end organ damage in this proportion of this group of patients also? So that is the importance of secondary objective. So I use secondary objective to my advantage of publishability here, rather than as a requirement for of the of the university in my research project. But yes, you are perfectly okay if you do not put secondary objectives, and you
And
focus one
and
primary objective only.
yeah, and Dr. Shah, there's one more question from Dr. Sumanta Raut. I think you know him very well.
Yeah.
He was saying that in West Bengal University of Health Science, they have got general objective and specific objective. Are they the same with primary and secondary objective, more or less?
More or less should be same. I general objective and specific objective. Like most of the research, if you look at the research, I mean, if you look at the review articles which talk about, say, objective, I mean, you can find, like, I have, whatever presentation I have done, I have searched some review articles on how to formulate research question by the experts, and then I am going by that. So similarly, if you look at the objective, if you find out some articles on objectives, so they usually say primary objective, secondary objective. In Indian pediatrics, we also use the same format, the primary objective and secondary objective only. And I think when we review articles, we also, look at the same line also. I think they should be these same thing. The specific objective would be the primary objective, and general objective would be the secondary objectives.
And so, is it mandatory to calculate sample size in every?
Yes, I think I'll be able to answer you.
Even for we are doing a simple prospective observational study.
Yes,
Then also.
yes. You should always calculate sample size before doing any study, except for 1 or 2 scenarios where you don't know. For example, I'll tell you one scenario. If you do a discovery phase of proteomics or metabolomics, you don't know. You are just discovering. You are discovering, say, 100 biomarkers. So you just take urine, you run that urine in mass spectrometry, and you are getting, say, 100 biomarkers. So this is a discovery phase of proteomics. Here comes the,
Suppose, sorry, I'm interrupting.
yeah.
Suppose I'm keeping it very simple. I
Yeah.
want to do a thesis where I've asked my PGT to look into the infectious complication in nephrotic syndrome.
Yes, yes. Here you will require sample size calculation. Here, what you will do, you will look at the previous studies. You will look at the
But
scenarios.
then I'm sorry, I'm interrupting.
Yeah.
So, but then I am limited to a thesis usually runs for 1 year. I'm
Yeah.
limited to 1 year. So
Yeah.
I'm limited that whatever number I'll get in that 1 year will be my sample size.
No, that
So
is
what
not the
is
correct.
the
No, no, that
the
is not the correct.
utility of
No,
calculating the sample?
no, I disagree with you. See, what we do here, and I think that should be done everywhere, is we calculate sample size. Say and here it's easy to calculate. You see the effect size. I mean, effect size, and say in the previous literature, say 25% of the admitted nephrotic syndrome in previous studies, hospitalized nephrotic syndrome, has got major infections. So major infection, you have to define that this will be major infections. Based on that, you take that, okay, I'll take 10% precision, absolute precision. That 10% means it could be anything between 15 to 35%. And based on that, I will play with the sample size, and I'll calculate the sample size and say my sample size comes out to just arbitrary 200. Now I know that I will not be able to get 200 samples in 1 year for my candidate. So I'll write down, and the university is perfectly okay with it, that the sample size is coming out to be 200. However, for the that is why that is when the finer criteria comes, feasibility, and you write down. However, for an MD thesis, it is not feasible to get 200 samples, and that is why a sample of 100 patients will be taken, 100 consecutive patients or whatever patients will be taken for this thesis, full stop. And nobody is going to object you. Now, why it is important to exercise the calculation of sample size? Because we are doing MD thesis, so that our student is exposed to the different steps of doing an MD thesis. And calculation of sample size is one of the very important step of doing an MD thesis. So once you ask him that, no, you get hold of, look at what are the softwares available, you download epi info, and you put on, this is, look at what variables to be put on in epi info, where to go about. There are so many categories given there. So for observational study, which type to be selected, and you come with the sample size. Do look at the video and ask somebody, ask your peer, and if you don't know, then I'll tell you how to calculate sample size. So he will do that exercise, so he will learn how to calculate sample size.
No,
That is the
I agree to it. I was just sort of trying to be the devil's advocate. And we have a comment from Sumanta Raut. I think this is sort of what you said, that for a MD thesis, we still have to do the sample size, but we can say
how
that
to link
because of
sample size with primary objective.
no,
So
the last one. Can we apply time limit filter for the MD thesis? That I think you have already
yeah,
covered.
I have answered. We do
Yeah.
write very clearly,
So
and
that's
there's no shame. Now there is one other question by Dr. Sabani Mishra: how to link sample size from primary objective. So in the example, I'll go by the example, how to link sample size with primary objective. So if you look at uh, in the example I gave, proportion of patients having hypertension in IRNS. So 25, I presume that 25 in my hypothesis, I have hypothesized that approximately, based on my day-to-day practice knowledge also, and my literature knowledge also, whatever literature search I have done, that approximately 25% should have hypertension, infrequently relapsing. So this, and I'm looking at, my primary objective is also looking at hypertension. So I will calculate sample size using this figure of 25%, And this is how I am linking my primary objective to sample size calculation. Now, if you look at, I have three more things written in the secondary objective. What is the proportion of patients having hypertension after in remission? So now here I do not have to take a presumption that what percentage of patients will remain hypertensive, or some there will be new onset hypertension. So some will go off, some will add on. So I don't have to go into that, number one. Number two, the secondary objectives say out of the 80%, uh, concentric abnormality, concentric remodeling was present in 15%. So whether the sample which I calculated with taking a presumption of 25% is fulfilling, is valid to answer the question whether concentric abnormality is present in 10 patients, whether it is valid or not, I don't have to calculate that. So that is what I meant to linking the sample size to your primary objective. Your research question is one, you have hypothesized it, quantified, you have translated that research question into hypothesis. You have put in that figure of 25% in the primary, in your hypothesis, using which we will calculate the sample size. And that is all, that is what is your primary objective for the studies, and you will use that 25% for calculating the sample size. That is what I meant, linking the hypothesis and sample size calculation to your primary objective. Now you cannot say कि मेरी hypothesis तो 25% की है, 25% of the patients are going to be hypertensive, but with 25% my sample size is coming too high, so I will change here the you cannot state in your protocol that. You can do that, change there in the hypothesis, modulate your sample size according to your need, say calculate with different figures. You also calculate with 20%, you also calculate with 30%, and whatever is feasible for your study you put in that, and then send that research protocol, but don't vary it. आप खुद से वहां पे वो मत कीजिए, otherwise then the university will have the objection that you are putting two figures there. That is the purpose, linking of
Okay.
hypothesis.
Thank you. Sorry, we were having a good discussion, but I think time is running out for the next speaker.
Yeah.
So, Abhijit, thank you very much for this.
It was a pleasure. It was a pleasure.
Do stay back if possible, for any further questions which might arise at the end. And we have, and remember that we also have asked you to be there on next Sunday also.
So I'll be here till 1 o'clock, and then actually today is Valentine's Day. So my wife and my daughter.
Which one? Your wife? Oh, okay. Sorry. This is not the appropriate place to discuss all this.
Why not?
No, I was going to ask something else, but anyway. No, but next Sunday आप रहिएगा, please.
I'll be
because
definitely.
we are hoping to have some group discussions between all of us.
Actually, our session is also at till 1 o'clock, so we'll all leave. Don't worry.
Okay.
Okay, so
thank you,
now
Dr.
I will.
Rajiv, Dr. Khemka, and Dr. Shayantani. It was a pleasure interacting with you all, and all the participants also, for asking wonderful questions. Thank you.
Thank
So
you.
I now ask Preeti to again reintroduce Dr. Shayantani, and
It is done already last day.
so you can take over now.
Yeah. Okay, hello. So, I mean, the discussion, which that is a very nice discussion, and I was learning so many things of your domain. So, actually, in our today's discussion, we have this sample size calculation, and this take little bit. So, what I'm planning is we have almost 30 minutes left. So I'm going briefly, and we have a plan with Dr. Rajiv to discuss. I mean, he can give some example of data, and then we can discuss how to interpret that particular data. So I can keep this for my Saturday session, because Saturday is a full session of 2 hours, and it's only statistics. And so there also we can continue just starting from here. Rajiv, is okay? Okay. So let me go through what is the data, how to collect, what is the methodology of data collection, and the sample size things. So, so this is the topic actually today's. So first of all, how to collect the data, and obviously you have to, if it is a, I mean, you have 4 different things to do actually to take the data, and it is actually initially it is randomization. Now, what is the meaning of randomization? It is actually, suppose I have 20 people in a class and I'm picking any 2. So for each of them, the probability or the chance of being in my sample is same. Then it would be known as randomization. That means it is not with any kind of calculation. It is not with any kind of spatial method. It is just by chance. So if I have, suppose I am picking Dr. Rajiv, so here we have 33 people. So the probability of picking Rajiv is 1 by 33. And it would be same for Priti. It would be same for Dr. Ovijit. So then it would, the meaning is a random sample. So here in our clinical research, we are using these 4 kind of randomization process. One is just simple randomization, which I have just now told. Second one, if I have something little bit of restricted randomization, so we need, obviously, if we are doing random studies, there is some kind of biasness, some kind of problem. So to avoid it, we can have a modified version of randomization, which is known as blocked or restricted randomization. Then we have stratified randomization and adaptive randomization. So I'm showing you with some graph figure that what is the meaning exactly. So it's a little small, but I'm just explaining. The first one, which is written as A, this is a simple randomization without any kind of modification or the restricted randomization. So initially, these are this black and white. We have some 6 balls, suppose 6 balls, black balls and 6 white balls. And I'm just taking randomly 2 groups. So without taking any kind of rules, regulations, methods, it is only by chance with equal probability I'm getting these 2. So this is called randomization. So I'm picking some in treatment A on my first group and some few in treatment B, which is my second group. Now, B and C are the example of restrictive or blocked random sample. So what I'm doing, if you check that in the first one, these 2 are little different. First one, I have taken 2 groups from the entire population, and the groups are, first group is having 2 black ball and 1 white ball, and the second group is having same. But next, I am doing the same process again in the same kind of ball, because I have three more in the entire population. So I'm taking the rest of the 2 white and black balls, and here also I'm taking rest of the 2 black balls and 1 white ball. So I'm checking just to minimize the biasness of my method of sampling. I'm just doing it twice. So first I'm picking in first block, I'm picking 2 white and black, 1 black. Second block also I have 2 black and 1 white. So this is 1 time of random sampling. And then I'm repeating the same, taking the same number of balls, same color, and just checking whether I have any kind of differences in my result or not. Number C, if you look, this is again first I'm picking any 2 groups, that is a pure randomization process. And then from these 2 groups, I'm taking 2 balls each. So initially in my first group, the left hand side, we have 3 black balls and 1 white ball. And right hand side, I have 3 white ball and 1 black ball. Then after that, I'm doing repeating it, not with the same number, it is opposite number, and I'm taking it with this small sample. So I'm doing the sampling twice. So my next observation, after this line, I have done 1 black and 1 white I have taken from the first group, And similarly, I have taken one black and one white from the second group. So this is also modified or blocked or restricted random sampling method. And only objective is to minimize the biasness of the process. The last one, which is written as D, it is the stratified lab randomization process. Now the strata means groups. So I have taken different strata. So what I have done, initially I have taken only white ball as my first or second strata, only black balls in my first strata, and then from this black balls only, again I'm taking two different groups because I need to have treatment A and treatment B. So from the black balls, I have 3 and 3 for treatment A and B. From white balls, I have 3 and 3 as my treatment A and B. So this is known as stratified randomization process. So again, I'm just going back. I have mentioned that when you take sample, we have to follow these 4 methods. So actually, basically, it is the randomization method. So we have simple randomization, we have blocked or restricted. So you can understand there we are just doing it twice. In the same group, I'm picking different combinations to check whether I have the same kind of results or not. And the third one is stratified. So it is totally different because I'm first making them into 2 totally separate groups. So in our example, I have taken a group of only black balls. I have taken a group of only white balls. And then from there, I'm doing the study of the treatment A and treatment B. And the fourth one, which is the adaptive one. So this is little complicated because we are doing adaptation. So suppose this is my sample population, same thing, 6 white balls and 6 black balls. And then I need to find out the treatment A. So treatment A is, suppose it is known as the first one, which I'm going to do. And here what I'm doing, it is known as the random sample with replacement. So I'm picking one white ball, checking the result, and then putting it back. So it is known as random sample with replacement. So I'm replacing it. Now we have 2 different outcomes. It's possible that the treatment A is successful. It is also possible that the treatment A is unsuccessful. Now, if we have successful treatment A, so I'm going to make it better. So what I'm doing, I'm including 1 extra white ball. So my odd ratio, that means how many balls are there. So A versus B, that means white versus black becomes 7:6. So this is one example. We can do different kinds of adaptation. And if my outcome of treatment A is unsuccessful, so I have to obviously I have to do something that it becomes successful. So what I'm doing, I'm putting a black ball there. So now the odd ratio becomes 6:7. So you can find that we have 6 white balls till now, but we have 7 black balls because we have included 1. So this is only one example. You can understand we have lots and lots of different kinds of adaptation we can do according to our research objective and according to our data structure. But again, I'm repeating what is happening here. First, in this example, first, I am only checking about white ball, and this is my treatment A. So if I do it, first we have to pick one of the white ball and then putting it back in the sample size and checking the result. So I can have 2 results. One, I can have successful outcome. 2, I can have unsuccessful outcome. So if we have successful outcome, so I understand that that white ball, the treatment A is successful. So I'm putting 1 more white ball to make it more powerful. And if it is unsuccessful, so I have to think otherwise. So I am putting 1 black ball to do the entire process again. So this is also a randomization process, but it depends on the first outcome. And again, according to the outcome, I'm doing different, I'm just modifying, and we am doing trial and error method to make it more powerful test. So these are the 4 different methods of random sampling you can do in your clinical research. In our research, which is not clinical, so we have also random sampling method, and we have others also. We have to do purposive sampling. We can do multi-stage sampling. We can do systematic sampling. So lots more. But the random sampling, all of them are coming under random sampling. So here in your clinical research, we can just make it like that, because obviously for you the answers, your research outcome can be more crucial because you are dealing with human lives. So obviously you have to be more careful, and that is why I think this adaptive randomization method would be better, because you can take time, you can go and you can do the sampling method again and again to make your result or outcome better. Now, after this process, we have, so now what kind of research studies, as we are also discussing in the last class also, but this is related to the data. So our clinical research can be categorized into prospective and retrospective studies. Now, what is the meaning of these two? So if you are using the existing data, which is already there, on current and past patients to answer your questions, so this is known as retrospective. So it is very clear from the name itself, because it is already there. So you don't have to collect the data is there, so it is just like the secondary data source, and you have to do some research on that. So this is called retrospective studies. Now, if it is prospective studies, then actually you need to collect the data in this method which I have shown. Maybe some other methods are there. So this prospective studies answer questions by collecting new data on current and future patients over a future period during which medically relevant events occur. So the basic difference is the retrospective studies are with the historical data. So obviously you can have the current data also somebody has collected for you, and you have the past data. But if it is a prospective studies, you have to collect it on your own. So it is the current data as well as the future patients data, because you have to find something and you have to apply it for the future cases. So this is the first difference in the studies, clinical research studies. One is the retrospective, one is perspective. Now, prospective. So in prospective studies, we have two different group. One is observational, other one is experimental. So under observational, we have three different categories. One is the cross-section studies. So we are discussing in the last class also. This cross-section means we cannot change the time period. So we can compare between different groups, but we cannot compare between different time frame. So the time would be fixed if we are doing cross-sectional studies. And we can compare gender-wise, we can compare cross-country, we can compare, as we are discussing about the corona cases, we can compare state-wise, we can compare before medication, after medicine. So anything can be done, but we cannot move across the time. So this is known as cross-section study. So this is the first under the observational studies. So the first one, clinical research, we have retrospective and prospective. Under prospective, we have observational and experimental. Under observational, so only we're doing with the data. So under observational, we have first one, cross-section, where we are not crossing the border of the time. Then we have the case control studies. So obviously it is, better that it is, we have to control one group and check for others. So here you can find that the investigators ask whether people with a particular disease or whose disease has progressed had different previous exposures than people who remained free of the disease or whose disease remained stable or improved. So again, I am comparing here, but I am taking one as my control group. So similarly, the same thing, if we have to find out something about COVID, so you can ask the question to the patients who are already had COVID and who haven't, that what is the past, whether they have done some kind of, suppose, whether they have used mask or not, whether they have used hand sanitizer or not, so blah, blah, blah. So this is only example that we have to keep one group as our control group, and other, on the basis of that, from this as a base, we should compare with others. So this is known as case control studies. This is also under the observational study. Then the cohort study, where we have to go beyond the time. So it is here investigators look forward in time from exposure to outcome. So here actually is just the opposite of the cross-sectional study where we have to move across the time. So the case control and cross-sectional, both of them should be done on one particular time period. But the difference is in the cross-section, all the groups should be treated equally. In case control, one group should be treated as the base and we have to compare the other. But the cohort study is different. It is where we can move across the time by comparing the frequencies and severity of outcomes in groups defined by different exposure. So these are the different types of study according to which you have to collect data actually. So this is nothing but the chart of the same thing. So you have, this is only the second part. So I have not done the retrospective here. So it is only the prospective studies where we have the same, so observational and experimental. And I have discussed this left portion because there you need to, you need statistician better, because for experimental, you have to actually do the different kind of, medical treatment, these things. So I'm just only focusing in that part of observational studies where you have to take observations, means you have to take data. Right, the same thing is written here. Now, after that, we have this. This is very important, as Dr. Vijit was also mentioning. Somebody has asked him that how to calculate the sample size. So this is entirely a portion of statistics that obviously you can do this pilot survey. And so if you are doing something, there's a first time. So obviously you have to do some kind of pilot survey, not only in your medical research, but in our every type of research. We normally do a pilot survey to understand the structure, and then we go for the actual survey. So here also, the sample size calculation is the critical thing, and especially for your case, because normally for our case, we always go for higher and higher sample size, because we know that as sample size is more, the outcome would be close to the reality. But here you have some problem also. If you cannot take a very high sample size, because that means if you are doing some research on them, not giving some one particular medicine to one particular group, so that could be a ethical problem also. So that is why the sample size is one of the first practical steps and statistical principle in designing the clinical trial to answer the research question. With smaller sample size in a study, you may not be able to detect the precise difference between the study groups, making the study unethical. So that is the problem. For your side, it is written as mentioned as ethical or unethical. For our side, definitely we don't have to think about the ethical thing of our survey. But if I'm doing something related to marketing, if I am doing something related to HR, so we also always go for a higher sample size, because otherwise we cannot have a right result of our research. So on the basis of our research, we have to give some policy suggestion to the companies. So obviously that policy suggestion would be wrong if I am doing it with a small sample. So here also the same thing, you should not have a very small sample size, because you cannot understand the difference between the two groups. Moreover, the results of the study cannot be generalized to the population, as the sample will be inadequate to represent the target population. So that I have mentioned in the last class also, that if I have taken a very small sample, then, and what is the meaning of the research, that on the basis of sample, I am giving a conclusion for my entire population. So if a sample size is very small, then it cannot, obviously it cannot be a good representation of the population. And then this study cannot be generalized for the entire population. On the other hand, this other hand part is not there for other kind of studies. I think it is only there in the clinical study, that by taking larger sample size in the study, we put more population to the risk of the intervention and also making the study unethical. So this is something special in case of clinical research, because you are taking some group under, you're doing some kind of intervention with a group of people and they are the patients maybe. So if this is the case, then obviously you should not have a very high sample size either. So it also results in wastage of precious resources and the researcher's time. So this is a critical thing to understand, that what should be the optimum sample size, because sample size cannot be too less, sample size cannot be too big. So where should we stop? So to understand that, again, we need to have three different concepts of statistics. And one already we have mentioned, lots of time we have discussed about the p-value. So again, this concept depends on the p-value. So in my next class, I will be actually defining, explaining what is exactly p-value. So here also you have to just listen to the name of the p-value. So first of all, everybody is familiar with p-value also. So we normally keep the value of p, which is less than 0.05. So that we have mentioned in the last class, and today's class also, Dr. Vijay has discussed that. So p is the probability value, and if p is less than 0.05, then you have to, you will be happy as a researcher that you are searching, whatever you are searching, you are going to get the same answer. So first thing we need to understand to find out sample size is the p-value or probability value, and it should be 0.05. So the meaning is that we have 95% confidence in our research. So if I'm taking the 100 times different samples from the same population, I am going to get the same result 95 times. So that is the meaning of 95% confidence level. So 95% confidence level means 5% significance level. So this 5% is nothing but 0.05. That is why 0.05p is so much of importance. Now, so you have to look into p-value, first of all, to find out the sample size. Second, you have to understand that what is the meaning of type 1 and type 2 error. And here, our focus in the clinical research, our focus is only with type 2 error when we are calculating the sample size. I'm telling you what is the meaning of type 2 error and type 1 error. So these three things actually you need to know. Power is very important, power of a test. So what is power of the test? Sometimes we may commit another type of error where we may fail to detect the difference when actually there is the difference. This is known as type 2 error. I'm going to explain. That detects false negative results. Exactly opposite to mentioned above, where we find the false positive results when actually there is no difference. To accept or reject the null hypothesis by adequate power, acceptable limit for the false negative rate must be decided before conducting the study. So before conducting the study, we need to understand the power and we need to understand the p-value. Now let me go to the, I'm just explaining what is the meaning of this thing. Type 1 and type 2 error. So the thing is, suppose you have one null hypothesis and one alternative hypothesis. As I have mentioned in the last class, that null hypothesis is the base and alternative, what is the doubt in your mind. So if I have, so here I have the alternative hypothesis H1, here I have the null hypothesis H0, right? And I can have the 4 different categories of results. Now, if the null hypothesis is, so null hypothesis can be true. So null hypothesis can be true and null hypothesis can be false. Similarly, alternative hypothesis can be true and they are not possible. They are mutually exclusive. So if null hypothesis is true, that means alternative cannot be true and vice versa. Now, so it is better to write in this fashion. Suppose this is our decision. This is better. So I'm putting in the top and hypothesis true false in the row. So if the null hypothesis is true and my decision is same, that null hypothesis is true, that means there is no error. So there is no error. Similarly, if null hypothesis is false, that means that is wrong, and I have my decision after study is also that it is wrong, that means I didn't have any kind of error. But in these two situations, I definitely have some error. So what is the difference in this error? Look into that. Look into this thing. So null hypothesis is actually false, and my decision is no, it is true. So that error is one particular kind of error. And now look into this cell. This cell is showing that null hypothesis is true, but my decision is no, it is wrong. So we have two different types of error. So if I write it again, so first one is I am rejecting. So if I'm saying false null hypothesis, that means I'm rejecting null hypothesis. So I am rejecting true null hypothesis, true A0. So this is one kind of error. Second kind of error is I am accepting false null hypothesis. This is the second kind of error. So first kind of error occurs here. That means I am rejecting a true null hypothesis. So this is this error, because this is my true null hypothesis and my decision is it is false. And the second kind of error is this one. So my null hypothesis is actually false, that is wrong, but my decision is I am thinking that it is true. That means I'm accepting a false null hypothesis. Yeah, I have a question. Let me finish it, then we can discuss the question. So first of all, so this type of error, rejecting a true null hypothesis, is known as type 1 error. And this is given as alpha. This is the notation is alpha. And accepting a false null hypothesis is known as type 2 error. And this is written by beta. So to find out a sample size, you need to understand specifically the beta, because beta is more critical for you, because you have, your original belief, that is your null hypothesis. If there is something wrong there only, then your entire research, entire outcome, and entire recommendation can be wrong. And that can be very crucial and fatal for the humanity. So that is why if you are doing critical research, then this type 2 error should be taken care of. Now, what is power of this test? Power of the test is 1 minus probability of occurrence of type 2 error. That means if power is more, that means the type 2 error is less. So I should have with a good amount of power in my clinical research. So I'm just again writing. So what is power? So I have just mentioned that 3 things you need to remember. One is p-value, one is power. So this power is equal to 1 minus probability of type 2 error. So when power is more, type 2 error is less. So my objective is to reduce the probability or chance of type 2 error. So I have to keep on a good amount of power. So this power should be fixed beforehand. The p-value should be fixed beforehand. And then you have to go for the sample size calculation. We have lots of software. So here also in Google, I have the screenshot also. You can go and you can click what is your requirement, and they can give you the number of sample sizes. But you need to understand that from where it has come. So it has come from the p-value. Again, we'll discussing thoroughly in the next session what is p-value. So p-value is a connection. Actually, p-value and type 1 error has some kind of connection. So that means you are taking care of type 1 error through p-value. You are taking care of type 2 error through power of the test. And with these two, you should find out. And there is a complicated formula which you don't need to know, because you have to put the values and you can automatically get the power sample sizes. So this is the power which we have to do. So this is the type 2 error, and the opposite of the type 2 error. And the third thing we can understand, that we need to understand, that is called the effect size. So normally you do research to find out the gaps between two groups. So effect size is the minimal difference that investigator wants to detect between the study group and is also termed as minimal clinical relevant difference. So we can estimate the effect size by three technique, as we were discussing in the, I'm listening to Dr. Ovijit, that it is a three technique we can use to understand that what can be the effect size, minimum effect size, so that we can do with the pilot study, or the previously reported data if you have, or the educated guess based on clinical experiences. This is nothing but the literature survey. So we need to know these three things to calculate a appropriate number of sample sizes. So again, one is the power, which is to minimize the probability of type 2 error. Second one is the p-value, which is again the same thing to find out the level of confidence you have in your research. And again, it is related to type 1 error that we'll discuss. And the third one is effect size, because most of the cases we do the research to compare between the two groups. So what should be the minimum differences we want? That is our effect size. And the effect size can be gathered, the knowledge about effect size, if you are doing the research first time, no past research, then you have to go with the pilot survey. If you have past research, then you can do with the reported data, or you can do with the literature survey. So this is what you can find in Google. So I have two screenshots. You have lots of different softwares, so different version, but the main thing is same. So here actually what the objective is to compare between the two mu. What is mu? Mu is the average or mean. So you have to put the value of sigma. So that means you have to, and if there is a concept called that what should be, so you know what is the value of, enter the value of mean of one group, enter the value of mean of second group, and sigma is known as standard deviation. So again, we will discuss it in the next class. Then again, the two-sided test and one-sided test also you should understand before putting it there. So two-sided test is where you have the alternative hypothesis is first value is not equal to second value. So not equal to means it could be more, it could be less. So it is two-sided. If my alternative hypothesis is the first value is greater than second value, or first value is only less than second value, so I'm considering only one side. So this is known as one-sided test. So according to your research objective, if your research objective is to find out the groups are not equal, so not equal means it can be greater, it can be less. So I'm taking both the sides. So two sides I have to click. If I'm asking for only greater than or only less than, I have to take one-sided. And then you can find that power of test, normally it would be fixed as 80.8. You can change it according to your need. Similarly, the alpha, which is, I have told, is a type 1 error. It is the same kind of formation of p-value. It is already given as 0.05. So if you just click on fill up the blanks, you will get your sample size of each sample separately. This is the same thing, another representation because it is another sample. So here also you have to anticipated incidence. You have to put, again, we are comparing between the two groups, and alpha is already given, power is already given. You can change by dragging this bar, and then you can understand. You can just click on calculate and you will get the value of your sample size of both the groups separately. So this is very easy to do, but when you have to write it in your research paper or your research and you have to present in front of the people, then you should understand what is the meaning and what is alpha, what is power, what is the effect size, and how to get this calculation of the sample sizes. Obviously, you don't have to go the complicated long formula, but you just need to understand the basic meaning of these things. So, Dr. Rajiv and Preeti, I think we can stop here because it is already 10 past 1. So I have a question here. So the question is, yeah, Preeti, you can just read it. Yeah.
Thank you very much for making a complicated topic very easy, and you have explained in detail about study design, sampling, and type 1-2 error. I have one question as well. So, and I think Dr. Abhijit would be able to answer as well. So when you're talking about the anticipated incidence in these sample sizing, so would you look at previous papers and then previous studies, and then take an anticipated incidence.
Yeah, so if it is there, obviously that is the objective of doing literature review. And if you have literature review, you have better outcome, better research.
What if you find 2 or 3 papers and they give you conflicting? Would you just randomly select any one article and paste it?
Yeah, I think that time you should go with a pilot survey as well, because it is not, the number of study is less and they are giving you different kinds of result. Dr. Rajiv and Dr. Abhijit is also here, maybe, so they can have some more input in this.
I'll just ask you in continuation. Suppose I'm trying to look at the difference between 2 drugs which close PDA. Suppose ibuprofen and paracetamol, and we've descriptive studies on which will give you an incidence on ibuprofen closure rates and PDA, and then paracetamol. Would you take 2 separate descriptive studies and incidence and then put them in your sample size calculation?
Can you please repeat the complicated terms you have just mentioned?
Suppose you have
Yeah.
drug A and drug B, and both can be used, and you have descriptive studies for each of these. Would you use those incidents in the sample size?
Yeah, so your objective is to compare between 2 drugs. Is it so? Drug A and drug B.
Yeah. So suppose you have a drug. Suppose in say COVID, we have got a drug A which kills COVID, and drug B also kills COVID, and you want to compare the two. But these studies are just descriptive studies. Look, so they are not comparative studies. They haven't compared the 2 drugs. Now you want to do a randomized control trial where you want to compare the 2 drugs and come out whether they are effective or not. So then I think Priti is asking that where would you get that number from? So she's asking that whether you'd use the previous descriptive study for calculating the sample size.
Okay, so that's the same thing. If you have previous research, then you can take help from them. So you can understand that what effect size is very, very important for this case. So that what is the minimal amount of sample size you need to get the difference in the answer. So that effect size, the idea of the effect size you can get from the previous study if it is there. Otherwise, again, the same thing, you have to do it on your own. That is a pilot survey you need to do and then continue. So, I mean, this is about the sample size calculation. I
And
suppose
someone
your question.
and someone is asked that for effect size, it has been mentioned in the slide that it might depend upon clinical experience. Does it mean it can be arbitrary? So the answer to that is that ideally you should do a pilot study. If you don't have previous study, then ideally you should do a pilot study. If not, then you can come up with a clinical experience.
Right. So clinical experience, I mean, your literature review comes under the clinical experience, not yours maybe, but some others.
Published.
So,
It
yeah,
has been published.
Absolutely.
And we have another question from Dr. Sharvani Mishra. If it is a community-based study, example pneumonia diagnosis, plenty of patients would be available. It just means that something which is a very high incidence, we'll have a large number of patients. So what would be our sample size then?
Yeah, so always I prefer to go with a, I mean, larger sample size, because our objective is to actually go for the entire population. So when I'm publishing something, I'm presenting something, that means I'm talking for the entire population. And my future researchers, suppose you have published your paper, so that would be our literature survey for the future generation. So they are going to take help from your study. So if your study is restricted with a smaller number of population, maybe from a small category, maybe age wise or gender wise or the location wise, it is restricted, then it would not be a good literature review for your future generation. So you have to always think about the entire population to have any kind of research. So if it is available and not that much crucial, then I think you have to go for a big as possible sample sizes. So that time, when we will discuss in the next class exactly what is type 1, type 2 error and why is it fixed at 0.8. So if you have 100% power, so then obviously that means your type 2 error probability is 0. So that would be a better result. So if you have this kind of easily available data without any much problem of ethical or unethical, then you can just drag the button from 0.8 to 0.9, 0.99 of power, and you can keep the p values as not only 0.05, you can go to 0.01 also. So then you can automatically understand their sample size becomes bigger, and it would be obviously better.
So, so just if I may, like commenting on this, Dr. Misra's point. So, what I understand is that, and Dr. Santini can uh, cross-check if I am saying wrong. Suppose you are dealing with a condition where you are not limited with numbers. So you are dealing with the conditions where you are sure if you want you can get 1 lakh per person enrolled into that study.
Yes.
Then should you be enrolling 1 lakh person or not? That also, the more you enroll, the stronger your study will be. But that will also bring in the question of ethics, because if you are doing an interventional study, then you are doing this study assuming that you don't know what is the effect. So if you're 100% sure that this drug will be good, then maybe you don't even need to do a randomized control trial. Suppose you are using drug A and giving someone drug A and giving someone drug B. You are doing this study primarily because you have a doubt that maybe drug A or drug B will not work in someone. But if you're 100% sure, then you will not do a RCT. So you are doing this study because you have inner doubt. And then the ethics question comes in, that do you really need to subject 1 lakh person to a drug which you are still in doubt? And that's where this whole statistics things also comes in, that okay, we need a certain sample through which we can have 95% confidence that yes, this drug will work. Am I right?
Yes. So if it is a drug thing, then though we have to think about the ethical part. But suppose if it is, we have lots of patients who have already have pneumonia in past, and we need to understand the effect only. I mean, without not the drug. I mean, side effects or something like that. Or maybe what are the after pneumonia, what can be the other effect? I mean, you know better than me. So that time too, we don't have the problem of this ethical or
Yeah,
unethical.
yeah, but then that time there's another problem, is that do you really need to devote that much of time and
Right.
resource for 1 lakh if that same question can be answered by 10,000?
Understood. Understood.
So
Yes.
this is also something that has to be kept in mind.
Yes. Right. So for pneumonia, diarrhea, it's unnecessary maybe. But if it is, suppose if it is COVID, since we don't know, then we can have something like that. Yeah, I think Priyankar is saying something.
No, I don't think he's saying
Okay.
anything.
Okay.
And the last question was by Dr. Maitri Basu, that observation of a particular parameter repeatedly during a particular period, example during a hospital stay, is it a cross-sectional study? So what's his meaning is that suppose we have got one person got admitted in the hospital. He or she is staying in the hospital for 5 days. Okay, and in these 5 days you have a repeated blood pressure in this particular person every day 4 times. So in these 5 days you have got 20 blood pressure readings. Okay, 5 days every day 4 times 20 blood pressure reading. So will this be categorized as cross sectional or not?
Cross section, normally, if we have to compare between two patients, then it can be categorized under cross section. So it could be two patients or two events. So here too, we are dealing with the same patients, maybe for 5 days. So I'm taking the ups and downs of his or her behavior, or the, post treatment
So it will
effect.
be more or less like a cross sectional only. Right?
It's a cross. It is not exactly cross section. Means I have to compare between the two groups, or at least two patients. So here too, my target group is only one, right? So I think it should be comes under the last one, which is the cohort study, because it is not
Cohort.
that much time series as
So
well.
So
5 days.
maybe I think we have to stop anyway now because we are overshooting the time. But I'll have a word with you, and maybe next day we can have some real examples.
Yeah. So
That will
you
make
please
it all
give.
very
I-
Yeah.
clear.
Then I
And
can.
one last question, real world, I would like to say, real world evidence versus randomized controlled trial.
I think we can. Priti, I just got a message from Somnatha that we have to
Okay,
close by 1:20. Otherwise, they might just disconnect it also.
okay. Then I think we'll end the session.